Hello friends, it's Zenith again here. So in this video, we'll be talking about some common radiographic and histological features and their associated disease. So let's just begin. So each disease has different distinct features and some are common to multiple diseases. These questions, when they come as an MCQ, they try to point out to a specific disease. So if we remember which characteristic is specific to certain disease and we put aside, it will be easier for us to answer the MCQs. So let's just look into it. What are these features and what are their associated diseases? So number one on the list is the multinucleated giant cell. A multinucleated giant cell are a special class of giant cell that is formed by the fusion of different monocytes, or you can call it macrophage, and it is abundantly found in human tissues. So there are certain specific diseases where you see the presence of these multinucleated giant cells. So just have a look at the list here. So this is a brief list where you see multinucleated giant cells. So if you see in a question that question has a histologic feature containing multinucleated giant cells, you can just remember this list. And how I remember is, there are two diseases. They have to have a name that says giant cells. So it could be peripheral or central giant cell granuloma. So if you have any of these in the options, you are sure that multinucleated giant cells are present in this. There are two other diseases that I remember as having cystosis and cyst. So this is a Langerhans cell histocystosis and aneurysmal bone cyst. And the other two are hyperparathyroidism and cherubism. So not a specific thing to remember this, but it's just dism and bism. So just to repeat, if you see in question, it says multinucleated giant cells present in the disease, you can just think of the two diseases containing giant cell and other two diseases named Langerhans cell histocystosis, aneurysmal bone cyst that has cyst in the name, and hyperparathyroidism and cherubism. So this was all about multinucleated giant cells. The next one on the list is cotton wool appearance. It is not histologic, it is a radiographic appearance that resembles a cotton wool. Actually, these are sclerotic patches that are poorly defined and fluffy, and it is because of the disorganized trabeculae which leads to the area of sclerosis in the previously lucent area. So it appears lucent and opaque haphazardly. So cotton wool appearance is present in Paget's disease, florid cemento-osseous dysplasia, and Gardner syndrome. Sometimes it is also seen in fibrous dysplasia, but for fibrous dysplasia, ground glass appearance is more common. So there is a key to remember all these diseases for cotton wool appearance. So the mnemonics here is Page grows cotton flowers in garden. So Page is for Paget's disease. Cotton is the cotton wool appearance, flower represents the florid cemento-osseous dysplasia, and in garden is Gardner's syndrome. So if you remember this line, you will remember that cotton wool appearance is present in Paget's disease, florid cemento-osseous dysplasia, and Gardner's syndrome. So the next on the list is ground glass appearance. It is a radiographic feature and it is seen mainly in fibrous dysplasia. There are other lung diseases also that we see, but on exam point of view, it is important for us to remember that fibrous dysplasia is associated with ground glass appearance. Also, one thing to note here, fibrous dysplasia can have multiple type of appearance on the radiograph. It could have cotton wool appearance also, it could have salt and pepper appearance also, but mainly for the MCQ point of view, we must remember ground glass is associated with fibrous dysplasia. Another feature is seen in the pulp chamber. There are variation that we see in multiple diseases. It could be obliterated, it could be bigger in size or smaller in size. So just have a look at the list here. So you may find questions suggesting the pulp chamber is enlarged or there is taurodontism present. So if they specifically say the pulp chamber is enlarged, there are two possibilities. Dental dysplasia type 2, remember it is not seen in type 1, and another one is regional odontodysplasia. It is also known as ghost teeth. So if you see these three words, enlarged pulp chamber, distal tube appearance, ghost teeth, they may be associated with these two diseases. The second possibility is to have taurodontism. Taurodontism is mainly found in so many syndromes, but the four major are Klinefelter syndrome, Down syndrome, amelogenesis imperfecta, and ectodermal dysplasia. So this is all about the pulp chamber. The next feature we are talking about is hypercementosis. So you can see this in extracted tooth also or in the radiograph. So these are the pictures showing how the tooth looks. So there is excessive deposition of cementum on the tooth and it is present in certain diseases. Just have a look at the list here. So deposition of cementum is a physiologic process and it is also seen in some pathologies. So here is the list. In the physiologic process, it is seen with the supraerupted teeth or in the teeth that has occlusal trauma. And if we talk about the diseases, it is associated with hyperthyroidism, pituitary gigantism, and Paget's disease. So the mnemonic here to remember this is shop. So if you have to buy cementum, you need to go to the shop. So this is how I remember this. S is for supraerupted teeth, H means hyperthyroidism, O is occlusal trauma, and P is for pituitary gigantism and Paget's disease. So the next on the list is onion skin appearance. So onion skin appearance can happen only in diseases when there is excessive proliferation. So actually the cortical bone is proliferating and it appears as onion skins. So there are two major diseases that we see onion skin appearance in. These are Ewing sarcoma and proliferative periostitis. It is also known as Gary's osteomyelitis. So Ewing sarcoma is a malignant disorder. So it has to have the proliferation of the cortical plate. And proliferative periostitis, the name suggests that there is proliferation process going on. So these two are the major disease that we see onion skin appearance of the bone in the radiograph. The next here is the widening of periodontal ligament. So we see this feature in so many regular disease like endodontic problems or periodontal disease, but it is associated with some certain disease other than this also. So let's have a look at the list here. So it is seen in orthodontic tooth movement, increased occlusal trauma. So here the PDL tries to compensate, that is why the widening of its space is seen. It is also present in endodontic or periapical pathosis. The two main diseases that we need to add to the list is osteosarcoma, the localized form, and scleroderma. It is seen in generalized scleroderma. So this will be all for this video. Thank you for watching.